Ear infections, colic are just two of the many common illnesses that we see in children, and oftentimes these elements can be linked back to the ASC, or in other words, a misaligned spine, and NUCCA care can be the perfect solution. So do kids need NUCCA? The question is better asked, are they misaligned? If so, then absolutely. But not all kids are misaligned, of course. Only about 10% of babies and about 50% of children are misaligned from what we've seen in our office. But if they are misaligned, isn't it important to get that child back in alignment the way God intended them as soon as possible? Without a doubt. Here's an example. Little Candace was 2 years old when she had an accident and fell down some stairs. Pretty severe fall, and her parents were very concerned. They ended up taking her to the emergency room and getting her checked out. The family took her home after a clean bill of health, and that night Candace didn't sleep well. The next day, she didn't eat as good as she normally would, and her digestion wasn't normal. She was having problems with constipation and different changes with her stomach. Candace's mother had been a NUCCA patient for years, and she had had great results, and she knew about how head and neck trauma can affect the health of the body because she had lived it out in her own body. After a week of these problems, Candace's mommy decided to get her checked out. Upon examination of Candace, I found that she had a significant misalignment. When laying flat on her back, Candace had a 1-inch leg length difference. So one of her legs was 1 inch shorter than the other. After some neurological tests to determine the type of correction necessary for Candace, she received her first correction. On post-evaluation, her legs had leveled off. She was checked a few more times, but only lost her correction one other time in the next 6 months. And Candace's symptoms? Gone. Now with kids, they are much more frequently miracle cases. They can heal so much faster from their injuries because their misalignments have been there so much less time. And in Candace's case, only about a week. Their misalignments are also much less complicated. Less traumas and more basic anatomy in the younger ones leads to a faster response usually. Kids are also full of vitality and have a greater potential to heal. So what if Candace's mother had never heard of NUCCA? Well, she would have had a hard time linking her change in health to the fall. Over time, she would have taken her to the pediatrician, most likely, and probably would have received medications for constipation, acid reflux, or something else. As Candace's body was forced to compensate for the tilting in the pelvis and the leg length discrepancy, she may have developed a compensating scoliosis or curvature in her spine. In later adulthood, some other symptoms likely would have begun, and Candace never would have thought to connect those to the spine and the nervous system. So how do kids get misalignments? Well, babies most commonly do receive a misalignment during the birth process. Forceps delivery, vacuum extraction, C-sections, and overzealous OBGYNs pulling on the head and the neck can all lead to the atlas misalignment at birth. Babies that are misaligned will frequently develop symptoms such as colic or ear infections, acid reflux, problems sleeping. Now, if a baby is not misaligned, the next time that misalignments frequently occur is as a child is learning to crawl and then to walk. After that, as a child begins to get more active, sports injuries can occur. Young children can be knocked unconscious or have concussions, have stitches to their head, and they can be involved in car accidents, have significant falls out of trees, flip over their handlebars on their bike and fall on their face.